The more we test, the higher the number of positive cases that we are likely to get. Today, 147 people have tested positive out of 2,831 samples now tested. This means that Kenya now has 1,618 people who have now tested positive. The cumulative test conducted so far is 70,172. And in terms of age distribution, the youngest is a 1-year-old infant, while the oldest is 87. These cases are spread across the country: 90 in Nairobi, 41 in Mombasa, Kiambu has another 3, and so on and so forth. We have also got now counties that have got cases that didn't have before. Nyeri has joined with 2, Uasin Gishu has 2, while Kajiado, Kilifi, Embu, Homa Bay, Murang'a, and Machakos all have at least 1 each. The distribution in Nairobi is as follows: Kebra, 35 persons; Langata, 15, and that's near Kibera as well; Makadara has 9, Westlands has 8, Embakasi Central has 6, Embakasi West has 5, Kamukonji has 2, Mathare an additional 1. You recall that yesterday we had 33 from Mathare. The reason why there is 1 is because we have contact traced and gotten all those people. And these people that we are mentioning here are sourced from different places. Some of them are in our quarantine facilities. Some of them are people who our team, the contact testing cases, who place themselves in the various streets and are carrying out tests, are picking from. And the normal way of doing this is that as soon as we know that somebody is positive, they are telephoned immediately, they are told to self-isolate, and then our Ministry of Health officials and the county health officials then go and pick them up in ambulances and take them to isolation facilities. I would also like to urge that there should be no stigmatization of individuals who have tested positive. I have said and I repeat, there is not a single person who is safe from getting or becoming COVID positive. Anybody can get it. You can get it, I can get it. And we have said this over and over again. And that's why we emphasize that when somebody is positive, what they need from us is care, empathy. This is what we should be concerned with. And when they turn negative, then we'll welcome them and be happy and pray and thank God that that is what has happened. So out of the 147 cases that I mentioned, all of them are actually Kenyans. We don't have any foreigners out of them. 87 of them are men, while 60 of them are women. Men continue to get to positive cases in much, much larger numbers than women. But even with rising numbers, I'm also glad to inform you that today we have discharged 13 patients who have recovered from the disease, and we are always happy to hear that. So our total number of recoveries now stands at 421. On a sad note, however, we have lost 3 people from the disease. One of them in Kiambu County, in Thika, and 2 others in Mombasa. Both of the cases in Mombasa had underlying conditions. I want to pass my sincere condolences to the families and friends of the departed. May their souls rest in eternal peace.